I'm April Harrison,
And I'm Marcella Ramirez, a nurse practitioner here.
and we'll be answering the top Google filler questions.
All right, April, I'll ask you first.
Okay,
So how does filler dissolver work?
Okay, so the filler dissolver is hyaluronidase. There's a couple brands. There's Vitrase, there's Hylenex. Basically, they're an enzyme that eats up or dissolves the hyaluronic acid gel filler. They work pretty quickly, almost instantly, and they're nice to have on hand because if we need to dissolve some filler, fine-tune some filler, that gives us the opportunity to do that. More importantly, we keep it on hand in case there's an emergency, meaning the filler gets into a blood vessel or causes a complication. We immediately jump on it and dissolve the filler right away, and so it's a must-have in our filler toolbox. Okay. So let's see, Marcella, does filler work?
Filler absolutely works. We usually show our patients before and after photos, typically right after their filler. Ideally, we like for them to come back in about 2 to 4 weeks. We feel that's when the filler looks its best because the swelling has gone down, the filler is able to settle in. But definitely filler works to add more volume to the face. As we age, we start to have more laxity. So by putting the filler in the right place, in the right amount, we're able to help tighten the skin, help to add a little bit more volume to the skin as well. And it all can be done in a very natural way. Does filler go away?
It does go away.
Unfortunately.
Yeah.
We wish it lasted longer.
Sometimes faster than we want, and sometimes it doesn't.
Yeah.
Yeah, it does go away. And it depends on the area that it's injected. Like around the mouth, it's going to go away faster than, say, in the temples or under the eyes. But also the plane of skin. Sometimes if it's injected very superficially, say for instance under the eyes, it can last for years. Even around the mouth, I've seen filler last for years. So a lot of it depends. There's some things that we don't totally understand yet, but ultimately it probably goes away at some point. Okay. All right. Oh, good one. Does filler move?
Does filler move? So we can, when we inject the filler, we are able to mold it. But usually it's not, if we inject in the cheek area, it's not going to move to around the mouth area. So usually when we inject the filler, we do like tiny little blebs, and then those we're able to mold so that they don't feel, you're not going to have any bumps or feel any bumps in that area. And sometimes, sometimes we try to mold that area, but sometimes those little bumps are left over. So I usually tell patients to come back within 7 days, because after 7 days, those fillers do become pretty hard and you're not able to mold them. But typically they're not going to move from one area to a whole different area. They're going to stay in that area, and you are again going to be able to mold them, but you only have a few days to mold the fillers. Does filler hurt?
Does filler hurt?
The needle going into
the filler doesn't hurt, but the needle can.
Yeah, exactly.
The needle.
Needle.
So, really most areas are not uncomfortable. The most sensitive area is around the mouth, and that's where we tend to feel more discomfort when we're getting fillers. So we use a strong topical anesthetic beforehand, and it works great. The fillers themselves have anesthetic mixed in with them. Most people do fine. If somebody's really uncomfortable, we can do a dental block, but most of the times we don't have to do that. But otherwise, you can feel pressure if we're using a cannula, which is not a needle, it's a thin hollow tube. That can lessen the risk of bruising and swelling, but it does feel a little pinchier when it's going in. But other than that, fillers are pretty comfortable. So yeah, we have a number of distraction devices that we use here. I have my little buzzer where if you've seen me on Instagram or if you're a patient of mine, you've seen this. People use this, so it vibrates. So it just tricks your nerves endings into thinking it's feeling vibration instead of discomfort. We have stress balls, we have a cold air blower, we have just ice packs, a number of distraction techniques to kind of get your mind off of it.
We get patients comfortable.
Mm-hmm. Here, Marcella, does filler cause swelling?
So the filler, it can. It's not just the filler. It's the other components. It's a needle going into your face. So even the needle by itself can cause a little bit of puffiness. And then the filler, it's hyaluronic acid. That's what it's made up of. And that underneath the skin can also cause a little bit of swelling. Plus, it's mixed in with some lidocaine. And lidocaine can also cause some swelling. And it also depends on the area. For example, lips always swell, and they're going to swell for up to about 2 weeks. I always tell patients, you're not going to like us at first after you do your lip filler, and then within 2 weeks, you're going to come back asking for some more. Just because, people always kind of freak out. They don't want that duck look, but you will have that duck lip for a week, if not up to 2 weeks.
2 days of buyer's remorse.
Yes, exactly. And then you just want some more because the swelling has gone down and it looks really nice. Awesome. It looks very pretty, but you're like, oh, I should have done a little bit more. And in other areas like the cheek, not so much. Underneath the eye area, you can also swell a bit. What we call the nasolabial fold, the marionette, they're not so much either. So again, it just kind of depends on the area that we're treating and how much swelling you're going to get. But it always goes away. Just like anytime you get any other kind of swelling, it always goes away. It can just take up to 2 weeks. Yeah, eye swelling. Yeah. Okay. Does filler cause bruising?
Yes, it can. I just say plan on bruising. Worst case scenario, if we don't have any, that's awesome. If a needle nicks a blood vessel under the surface of the skin, it will cause a bruise. It doesn't matter whose hand is on the syringe. It doesn't matter the filler that's in the syringe. It will cause a bruise. Of course, avoiding things like aspirin, blood thinners, anti-inflammatories will help. Not 100% guarantee you won't bruise. And using instruments like cannulas instead of needles can help, but you can still get a bruise even with that. So my best advice is just to don't plan any big social events for a week or two after a filler session, just to give the filler a chance to settle in, give the bruising a chance to go away, and the swelling a chance to go away.
And we also have things we can do for our patients as well. We have some heel lights, LED lights, and then photofacials, an IPL treatment if you have a bad bruise can also help to kind of make that bruise disappear a little bit faster. Arnica, there's also some some medications you can take, some vitamins you can take, but still a bruise is a bruise and it's on your face. It's just not fun, but it will go away.
And the next question is, how long does it take to go away? And I always say the bigger the bruise, the longer it's going to take to go away. So if it's a tiny one, it'll be gone in a couple days. But if it's a big one, a week or two.
Yeah. All right. I asked you right. No, you asked
me.
Okay.
Oh, this is a good one. Okay. Does filler stretch the skin?
Oh, that's so funny. I had just had this conversation with a patient today. And so, I can kind of understand why patients are concerned about that, right? Because you're injecting this gel-like substance underneath the skin, and so you think that by doing that over time is going to stretch the skin. But actually, there's been a lot of studies that have come out that actually show that by putting fillers underneath the skin, it actually helps with collagen stimulation. So again, fillers are made of what's called hyaluronic acid, and that can be a precursor to help with developing collagen. So what they have found now that we have fillers, that we've had fillers for so many years, is that patients who are good about keeping up with their fillers are actually needing less and less fillers as they continue to age. So we're actually seeing the opposite, that it's not stretching out the skin, but instead it's actually just helping you to age more naturally, not age as fast, versus if you didn't have any fillers at all.
And I think if you're not stretching the skin out beyond the natural boundaries, then you don't have as much risk of it causing laxity or sagging later.
Does filler cause acne?
No, filler doesn't cause acne. Sometimes the numbing cream we use, it's kind of a sticky, it's more like a lotion base.
Yeah, it can be kind of greasy.
And I suppose if you were to leave it on for an extended amount of time, it could clog a pore or two. But I haven't heard much reports from my patients on the numbing cream causing acne, and I haven't heard of fillers causing acne either.
I mean, if you have acne, you're going to still have acne.
So we are really good about making sure your skin is super clean before we do any injections. So we do a triple layer technique. We clean the numbing cream off your skin. We use alcohol, hydrogen peroxide, and a surgical scrub to make sure there's no bacteria on the skin. That's mainly so we're not putting you at risk for infection, but also could potentially help with causing acne too, or not causing acne. So, whose turn is it?
I think it's you, right?
Yeah. How long does filler stay in place?
Filler can last, it depends on what the type of filler that we're using. There have been some really good fillers that have come out in the market the last few years that can last up to 2 years. Like for example, Voluma can last up to 2 years. Restylane Lift can last about 18 months. So those are a little bit thicker fillers. And so those thicker fillers we like to use in the areas, like in the cheek area, jawline, where we want to create more of that lifting for the face. Around the mouth area, there's one that's called Velour from Allergan, and that was going to last about 18 months. So I would say anywhere between 12 to 24 months, again, depending on what area you're injecting, what type of filler you're using as well. Because like April said before, around the mouth area where you use those muscles so much, those fillers are going to break down a little bit faster. But in the cheek and the tear trough area, they're going to last a little bit longer. Thank you guys for watching. If you like what we presented today, please like and subscribe so we can keep on giving you guys some good information.
And look down below, and if there's any additional questions, email us and we're happy to answer.
Thank you.
Okay.